If you had car sickness as a kid, this is a clue about why you could be dizzy today. You see, I've been seeing patients for almost 17 years, and there is just patterns that show up over and over and over again. And people that have a history of getting car sick often show up with dizziness, which can be rocking or swaying, unsteady, unbalanced, lightheaded, floaty, which is different than vertigo. Vertigo means the whole world is spinning or the room has a sense of motion. And you could have both. They could have ringing or fullness in their ears. But what we often see is that's a clue that you're going to have a certain diagnosis later in life. Now, we don't see it in a vacuum. We often see brain fog, fatigue, unexplained anxiety. You get digestive issues, heart palpitations, because the vestibular centers in the brainstem are often linked with your fight or flight system. The vagus nerve controls that with a connection to the body with that gut brain axis. And so we see this culmination of symptoms or this constellation that usually goes together. It's hard to have one without the other because you're affecting the control centers in the brainstem. And when that's affected, it's hard not to have neck pain. How many people do you know that have autonomic dysfunction? They're stuck in fight or flight. They've got dizziness. They've got all these other symptoms and they don't have neck pain. You almost never see it. In my years in practice, we see them, of course, but it's very uncommon. So there's a link. They're all linked together for a reason because the same areas are affected. It could be an old accident, an old injury, but it's causing a structural problem at the base of the skull or the craniocervical junction that's leading to this dysfunction. It's not a pathology, which is why your scans show up clear, your MRIs are clear, and then you're just left on this path running from doctor to doctor to doctor, trying to figure out what's wrong. And they're all looking for pathology, and that's why they don't find it because it's dysfunctional. So you need to have the structural problem at the base of the skull. We call it the craniocervical junction evaluated because every nerve in your entire body runs through the craniocervical junction or it originates here. All the blood flow and all the cerebral spinal fluid that clear the waste products from your brain, they're all at this tiny choke point. So if this sounds like you, if you're having these symptoms and you can't really figure out what's going on, leave a comment below. We'll get you information about how we could potentially help with these types of cases.